Welcome, Grace Clark-Hibbs, to the Dina podcast. I'm so excited to talk to another fellow dietitian. How are you doing today?
I'm doing great, and I'm really excited as well to chat with you today.
Yes, I was just saying for those of you watching on YouTube, Grace and I don't know each other, but we color coordinated our outfits. So of visual interest. Grace, share with us a little bit about where it started for you, of how you got involved in dietetics. I know that you brought to what you shared with me in some of the information that I read about you, that you had a personal story. And
Mhm.
sometimes that's the case with a lot of us, but sometimes it's not. So let
Yeah.
our audience know what got you into this profession.
So I actually went to college studying acting, so thinking I was going to be an actress. It's another love of mine, but I just didn't really know what else to do, kind of. So that's how that went. And then as I started to just kind of get into college and kind of that routine, I was really struggling with digestive issues at the time, kind of the end of high school and early college. And just really frustrated kind of with the care that I was getting and wanting to learn more. And so I took my very first nutrition class I think it was my sophomore year in college, and was just fascinated by it. And it kind of opened up this whole world that I had no idea existed. I had literally no idea you could like have a career in nutrition. And it kind of just blossomed from there. So yeah, that's how that started.
What a way to start and kind of end. Is it fair to say, do you have still some attachment to the creative arts in any way? Like, do you still dabble in things like that?
Oh yeah, 100%. I mean, I definitely do it on my free time and not as much right now because I am growing my own business, which is relatively new. But as much as I can do it, I love to do it. I volunteer for a local community theater as well. So it's something that I'm very passionate about. And then I'm also trying to figure out ways to integrate it into my career and trying to do more like media work and kind of on-camera stuff.
That is so powerful because a lot of times, and I'm sure you might have known this too, since you just admitted that you didn't know what the direction was when you first
Yeah.
started with your nutrition class. And sometimes students or interns might be a little confused too about where they see themselves going and whether or not they can marry together some previous skills. And there's always a way to make
Yeah.
things work. So I love that not only can you do this as, a secondary option for however you decide to either make money or bring yourself enjoyment, but also marrying that, like
Mhm.
noticing the skill set that you have and the ability to integrate that in some way. So that's a perfect example for anyone
Yeah.
listening who's not sure of the direction to go in. You don't have to work in a hospital. You can do things like media stuff and, whatever strengths speak to you. So make sure you're always giving yourself or looking for opportunities like that. So, Grace, share with me what a current week in the life of you might be. What is it that you are doing most often? What patient population are you working with?
Oh, right now I am primarily working as a consultant for two other dietitian private practices. It's all virtual, so I work 100% from home. I spend probably the middle of my week, so Tuesday through Thursday, seeing clients, and I work as the consultant as the gut health specialist. So, working with mostly women, but men as well, and we're just kind of digging into whatever digestive issues they have going on, and we'll do like functional testing and things like that, how it connects to other conditions that they're experiencing, and so on and so forth. And then on Mondays and Fridays, I have that as like dedicated to my work and growing my side of the business. So I have a blog that is pretty comprehensive. And then I'm developing my own program that I'm going to sell to clients as well. So
Oh,
yeah.
that is fantastic. Well, we were talking about before I hit record, but also this comes up every so often in different episodes in the past, however many years that we've been doing this now. The gut is sometimes can be very challenging and complex to navigate, and so many things can cause us to have gut issues, or the gut issues that we have can potentially exacerbate different things that we are managing or dealing with. So,
Yeah.
what is it that kind of spurred you into this particular specialty? And then, for the sake of both the community who is maybe the patient population, but also the student or intern population, what does it entail to feel like you get a handle of this, very challenging condition?
Obviously, I mean, I shared a little bit at the beginning that I was dealing with my own GI issues when I first got into nutrition. At that time, I didn't really think about it as far as like what I was going to do with work. And I actually started my career in school food service management. So I've been all over the place, but the gut issues have just been that underlying thing in my life. And knowing that I obviously wanted to figure out what's going on with myself, I really is like, finally it was like, okay, I need to do something different. What I'm doing right now is not working and I need to figure out what's going on. And so I started to do my own education, I guess, into the functional nutrition and functional health realm. And that is really where I started to find like actual relief for my own symptoms. And it was pretty powerful. It was like, wow, this is a huge piece that's been missing, like this approach and this style that's been missing to my own digestive journey. And as I got more into it, I was like, I really love learning about this. We didn't learn about it in this way in school. So I'm really enjoying this and I want to be able to help other people achieve the same results because I know I'm not alone.
Oh, for sure you're not. Can you define or explain to our audience what the difference might be with the functional approach versus maybe a more traditional or conventional approach?
So I like to describe it as like conventional. We're usually just looking at and treating the symptoms. So like if you're dealing with bloat and constipation, we're receiving things like laxatives or things like that that are maybe going to take care of that symptom immediately, but not necessarily figuring out why it's happening in the first place. So the functional approach is really like digging deeper, lifting, the hood of that car up and saying like what's going on underneath, and figuring out what sort of problems are leading to this. And usually it's multifactorial. We have to look at the body like holistically, lifestyle, diet, potentially supplements involved, things like that. But it's a multifactorial situation, and we're really getting to the root cause of what is causing those symptoms.
And you were saying before too, academically, I mean, there's only so much that we can kind of cram into our textbooks when we're learning. And I think when we do venture out to be in the real world, outside of maybe even our internship, like I want to ask a little bit about that too. Did you find that some of the discussion around more holistic approaches or people that you were working with within your rotations, did gut health come up at that point too? And if so, how did each of those experiences maybe tell you what you did or did not want to have happen in the way that you are taking your own approach going forward now from this point?
I would say no, not at all. It didn't come up at all. I mean, I think if I think back, it's been a little while, but I did have one rotation in a hospital where I worked with a little bit of GI stuff, but it was like very clinical. Like there was an obstruction and in the bowel and things like that. That was obviously causing a lot of problems. But and that was resolved surgically because that was the only way it could have been resolved. But other than that, I would say not at all throughout my internship. And then in my undergrad, it was just rudimentary, very basic, as far as like how the digestive system works on a biological level.
Right, like sites of absorption and the
Yeah.
different sphincters across the land there.
Yes.
One of the things I wanted to ask you too, when you're talking about the root causes, are you noticing certain factors that feel more prevalent? And I realize, obviously, as always is the case in dietetics, it depends for
Yeah.
everything, but are things showing up more regularly when you're meeting with your patients?
Yeah, 100%. And I feel like this is kind of, I don't know, some people may take it as like a cop-out answer, but absolutely stress is an underlying issue 100%. And it affects so many different things. It affects, how we utilize our nutrients, especially our minerals, how our like stress response is working. So our adrenal glands and that the HPA axis and all of that and how we process our stress. So that has a really big impact on our digestive system. If we're trying to like eat and digest our food when we're just in this constant state of like fight or flight, or our sympathetic nervous system is activated, we're physiologically not set up to digest our food. We're not going to be producing stomach acid, enzymes. We're not even producing saliva at that time. So that is like a key foundational piece. The other piece that I would say, which also kind of sits in the stress bucket, is just not eating enough and blood sugar imbalances, which are important for every single one of us, regardless of whether we have diabetes or anything like that. So I would say those two are the biggest ones.
Yeah, that's great insight. One of the things that I know comes up in some of the conversations that I've had with my own patients. And also, I went through some GI issues back in the day. 1,000,000,000% stress was related to some of my first issues because I was
Yeah.
working in an environment that was very, very toxic. And I also don't think that I knew at the time how to react to things or how to
Yeah.
set boundaries. And so, share with us a little bit about that too. Like, people think we're dietitians, you talk about food and you make salads and whatever, but no,
Yeah.
there's behavioral approaches to that too. So, if some of the root issues could be stress related,
Mhm.
what are some of the things that you are maybe helping, guiding, recommending to your patients in order to at least address that? Because obviously, we live in a world, a society, a country that things are very, very quick and rushed, and
Yeah.
we're juggling a million different things. So, how realistic is it that people are going to be able to manage that stuff? What are some of the things that you give them as far as guidance is concerned?
So I always try to start with, I mean, it depends on the client, of course, but those low-hanging fruit, I feel like if we can at least pull our body into our rest and digest nervous system before eating and while we're eating, that can make a huge impact on stress overall, but our digestive process, if we're talking about that specifically. Um, so I will like if people are in that lifestyle of just like I have no time, I'm racing, I can barely getting out the door so I can get to my kids to school, I get to work, all of those things. It's like, can you at least kind of set a little bit of time around while you're eating and make that the focus of what you're doing at that time? I call it meal hygiene. So really allowing enough time so that you can sit and eat and focus on eating, trying not to eat while you're distracted. So not while you're working, not while you're driving, not while you're putting on makeup, kind of all of those things, like really sit and focus. If you need to put something on to kind of, if your mind's always going, like putting on a podcast or putting on music to kind of help with that environment can make a really big difference. And even doing some like deep breathing, some box breathing, I'll go through. So breathing in for 4, holding for 4, breathing out, kind of that style of just really pulling yourself out of that fight or flight around meals first. And then when people start to see kind of, oh, I feel a little bit better, that it starts to click. But it takes time and it really depends, obviously, on the client and kind of where they're at. But supporting them through that is really important.
Yeah, key word, it takes, or key phrase, it takes time. And that's where I feel like sometimes people have a luxury of being able to do that. Other people might feel like they need to correct or rectify a situation because they might be in true physiological pain or maybe discomfort in that sense. And so obviously, I think we can both acknowledge that, yeah, okay, if you're in that condition where you're feeling way uncomfortable or like you're starting to correlate whenever I eat something, this is the reaction I have. But over time, I think focusing on the first and foremost of just trying to settle, quote unquote, settle the stomach in that sense
Yeah.
too, and allowing that to be undistracted. I often share with people I work with, and I used to do this myself too, where I would eat at my desk while I was working because
Mhm.
maybe I would use my lunch hour or lunch break to like run an errand or go to the
Mhm.
doctor's or take a real quick walk outside, but the food would sit next to me while I'm typing away. And I think that's something too that's just become very regular in a lot
Yeah.
of people's lives of eating while and not
Mhm.
necessarily focusing on that. And when we talk I think majority of the time we're talking lower GI, but or lower in the small intestine area, but gut can happen
Mhm.
anywhere in it. When we're talking about that, how would somebody differentiate if they do have a true, whether it's an allergy, a sensitivity issue, or it's just the body's way of digesting and metabolizing things, like legumes and fiber-rich foods are going
Mhm.
to naturally ferment in our lower gut, and that can cause some bloating or can cause some gas. Where do you have them look at, or are there certain like screenings or things that you do with them to really determine kind of like first case scenario and then worst case scenario of something is potentially a lot more clinically
Mhm.
involved, in which case then you would probably figure out what your approach might have to be.
So it's kind of a lot of little things. So what I will do, I mean, with everybody who I work with, we always work on setting that foundation. So that blood sugar management, making sure you're getting enough energy, and that stress kind of piece of it is going to be throughout your entire life, but definitely while we're working together. And so that kind of seeing how much that takes care of, is one piece of it. I also do a comprehensive stool test. So it's called the GI map, and it gives us a lot of information. It'll let us know if there's any sort of like pathogens that are in there that can be contributing to some of these issues. Some other dysfunction that can be going on, how well you're digesting fat, how well your pancreas is releasing enzymes, which is really important piece of the digestive process, what the balance of gut bugs looks like in your digestive tract. So, how many good bacteria, probiotic bacteria do you have compared to some of that overgrowth bacteria that may be leading to more fermentation and symptoms and things like that? What that looks like, what your gut immune system looks like, which is a really important piece, especially with regards to food sensitivities. So a lot of times if people come to me saying that they have a bunch of food sensitivities or that they've cut a bunch of foods out trying to figure out what's causing these symptoms, I don't know, the perfect number, but a lot of times that has to do with your gut immune system being burnt out and suppressed. And so we really need to work on supporting that, because that's kind of your first line of defense of what is telling your body like, oh, this food is safe or this food is not safe, or this is a safe component or this is not safe. And if it doesn't have the manpower essentially to do that and do what it needs to do, it's going to deem everything unsafe. So a lot of times if you're dealing with a lot of food sensitivities, it's more about the health of your gut, the health of your gut lining, the health of your gut immune system versus the foods itself. So once we kind of establish this baseline, we've done some testing, and if we're not seeing improvement, or if testing indicates there is some specific, sensitivity or something we need to pay a little bit more attention to, that would be the time where I'm like, okay, let's try taking this food out specifically. But my goal is always to get you to eat as more diverse a diet and variety as possible, because that's really what leads to an overall healthy digestive system.
I'd like to also speak a little bit about the fear factor, which I totally understand when people are dealing with things that they're just like, I don't know what's in
Mhm.
something, or I can't socialize now because I don't know who made the food at the place that I'm eating,
Yeah.
or what people are putting into the meal when I show up at the picnic, where we can maybe see signs of either fear or disordered eating patterns. How might you address that as well, just to make sure that people are feeling safe and that are not afraid to
Mhm.
start reintroducing things and testing things out?
I try to redirect to like the blood sugar balance a lot. Like we're the strategies for that is to like build a balanced plate. So are you getting enough protein? Like what does your plate look like? Are you getting like a variety of fruits and vegetables, and kind of coach the redirection of that focus versus like specific ingredients? Like, well, yes, there are things, we have a lot of preservatives or things like that that are in foods that maybe we don't want to consume, and can kind of increase that toxic load on the body and make it a little bit more challenging to detoxify and everything. Number one, we need to work on making sure the body feels safe, which is through managing your blood sugar, making sure you have enough energy to do all of the things that you need to do, enough fuel to do all the things, all the pieces, the ingredients to make everything that you need to function. And that needs to be the focus first, and then we can kind of fine tune later. So, acknowledging where they're at and acknowledging that that fear is real and valid, but through education and coaching and stuff, kind of trying to redirect that energy and focus to something else.
I appreciate that, Grace. And this has been brought up in past episodes, but I'm just going to clarify and define when the language that we're using. So we're talking about the quantity and the quality. The quantity of your food is what gives you the calories, and calories gives you energy. Like we often use the, analogy of putting gas in your car, fueling up your body. And the
Mm-hmm.
quality of your food are those more micronutrient things that are the vitamins and minerals and things that are going to help support your cellular health and be able to do all the fun things and protect against all the bad things. And
Yeah.
so having that good combination, even if, right, and correct me if I'm wrong, even if it does come down to a smaller subset of actual like ingredients, the role that we play as dietitians is to make sure that we're still satisfying a little bit of everything. So you might have a certain, thing that you're not eating, but there's maybe a family member of that group or a different version of that
Mm.
group that will still allow you to have the
Mm-hmm.
micronutrients. If not, you did mention something about supplementation. So how
Mm-hmm.
far along do you go, or is it in tandem where you might be providing supplements while you're still working on something just to make sure that someone's not deficient in those micronutrients?
It kind of works in tandem and it depends on the client for sure. And I really want to make sure that they're able to digest and process and absorb the food that they're doing first, since my like niche is the digestive, gut health. So making sure that you're able to like get the most out of what you're eating to begin with, because you're so that your gut is healthy and all of those kinds of things that it needs to do. And then if we're still having persistent specific symptoms or noticing that like labs come back persistently low or things like that, then yeah, introducing supplements and to support that as well.
Thank you for that. I was wondering too, we often take the approach of having all foods fit or flexibility. Are there foods that you would probably encourage people to very much limit or avoid, whether it's food or beverages, things that you know for a fact if somebody is going through some gastrointestinal disorder,
Mhm.
disruption, whether it's temporary or permanent, what are some things that might be on the list of like, it's probably best that you don't have this? Or are there
Mhm.
any? Are there any, Grace?
I would say the biggest one and first one that comes to mind is like artificial sweeteners can be very irritating on the gut. So especially if you're struggling with like loose stools and diarrhea and things like that, having those artificial sweeteners and like diet food, so like diet sodas, and even a big one that a lot of clients don't think of when I ask that question would be like a coffee creamer that they're using in the morning, or protein powders, and protein bars, which, as a food, food is not necessarily bad, but we want to kind of find the higher quality ones that don't use a lot of those extra ingredients, especially those artificial sweeteners, because those can be really irritating on the gut and exacerbate symptoms.
Where does the role of physical activity come in all of this too?
Super important. I think getting some, I like to call it gentle movement, especially when you're kind of at the peak of your symptoms or really like dealing with a lot of this. If we're really in that healing journey, like we're really at the start of it, we don't want to put too much extra stress on the body by doing higher intensity exercise. So gentle movement, walks, things like that can be really helpful. Yoga, stretching, still getting the things moving, and with things like constipation and things like that, that's an essential piece of it. But you can go too far in the other direction and can kind of be tied to that underfueling, so not getting enough of that quantity. We can be overworking and be putting additional stress on the body. So stress is not always kind of what we think of as stress, or that easy, I'm so stressed out, emotionally stressed, or I'm so busy, but that those internal stressors on the body, like overexercising when we're just not equipped to deal with it right now.
I want to switch back off for a second to the more business professional side of things. So share with us a little bit about the path that you're currently taking, right? The things that you're trying to build up as far as your presence is concerned or where you might see things going. A lot of times when we have these conversations with fellow dietitians, we talk about the scope of practice and the things that we have to do to maintain our credential with continuing education units. So
Mhm.
are there certain resources that you try to stay up with? How do you build your own skills, whether it's through the media channel or the gut health channel, any membership groups that you might want to share too? Like,
Mhm.
what is it exactly that you're looking at to make sure that you're staying on the path that you want to be on to help grow your next chapter of your life?
There's one dietitian in particular who I really looked to when I was kind of going through this process of transitioning from my last job into the gut health space and like private practice and entrepreneurship. Her name is Dr. Heather Finley. She has a pretty big presence on Instagram. And she sees clients and has a very great program for clients, but she also has a gut practitioner program. So she teaches other practitioners of all types, how to incorporate gut work into their practice as well. So she is an amazing resource. She has a full course, and then as well as a membership group. So I'm part of the membership group at this point. I did her course and I'm doing the membership, which is a great way to stay connected with other people who are doing, I think most of them are RDs or some kind of health professional. And support each other. We work on, we'll collaborate on case studies and get support and things like that. So that's a great source if you're wanting to go into gut health specifically.
I think that's an investment that we make for ourselves, and
Yeah.
also it benefits the people with whom we're working because anybody who might remain stagnant, like a lot of times when you have these discussions, it's like, is it a job or is it a career? Well, a job sometimes you don't put as much effort into, or you might
Yeah.
feel like doesn't really bring you joy out of it anymore. And so you're doing a disservice to the people with whom you're working because you only know what you know, but you're not staying current with research, or
Oh yeah.
you're not updating some of the things that you are really interested in too. And I think that really draws a particular clientele your way. We all have the background of being dietitians as far as the credential is concerned, but the way that we approach things is the way that other people might pick up on whether or not they want to work with us, right? Your
Hmm.
delivery might be different than someone else's delivery. So where do you see your future going? You were mentioning before about maybe doing some programs too. So what do you have as far as the future goals for yourself?
I have big dreams. So I am creating my own program. So like I mentioned, I'm just right now I'm a consultant for other private practices, but I would like to be fully like within my own practice. I have we'll be launching a program this winter, so right before the holidays. That's going to start in January. And I see that, this will be the first iteration of it. So it'll obviously, I'm going to have a lot to learn and be able to kind of tweak it and see how that goes. But I see that being kind of like a tiered system. So a part one level being, completely passive. This is someone who can take, just take the modules and go through it at a self-pace and be able to like address their issues on their own. And then the higher tiers will be some more one-on-one space with me, additional testing, things like that, and creating like more personalized protocols for them. I would love to write a book someday. I would love to work more in the media and potentially like consulting with brands, and things like that. So, and do more public speaking, is another piece. I would like to do some corporate wellness, integrate some corporate wellness work into there as well.
We are speaking it into existence for you right now, Grace.
Thank you.
So let it be. Let's talk a little bit more about that too. Like in the patient's end of things, right? They sometimes will go to their doctor, maybe get a referral, or maybe find dietitians somewhere in their insurance directory. But they don't necessarily know that there are other ways that they can
Mm,
work with a professional like us. So do you
mhm.
have any guidance for the people who are currently going through maybe frustrating going maybe to a GI doctor or their PCP and just not getting the answers that we want? Like,
Mm.
where are they supposed to find you or other resources that help support them that are qualified, credentialed
Yeah.
professionals?
Yeah, that's a good qualifier. And that's really hard too, because I have seen the most growth in my own business through my blog, which is SEO optimized. So people are finding me through Google searches and, searching keywords, and my articles are coming up. So I have put out like really comprehensive, really detailed, informative articles, and that is the way people are finding me. You can go super wrong with Dr. Google as well. So it's hard. And even like social media, which I have a lot of great colleagues that are on like Instagram and things like that, and they share a lot of great information, but there's also a lot of really bad information out there, a lot of misinformation. So you really do need to do a little bit of your own research. I would say, like finding someone you maybe relate to their content, and then if they have some way to talk to them face to face for a little bit, so you can get to know them a little bit better, what their approach is. That I would kind of do a little bit of your own shopping around a little bit. But know that there are other avenues out there. You don't have to just rely on your doctor telling you that, oh, your tests are normal, like you're fine. There's other resources out there for you.
Or dismissing you, thinking it's all in your head or that you're not really having valid symptoms. So
Yeah.
definitely there are people out there to support you. And like Grace was saying to like look in the about pages of people's
Hmm.
websites, do a little deep dive and maybe even cross-check what the terminology is, because in our world we can call ourselves nutritionists, we can call ourselves health coaches if we wanted to, but did we go to school for something? Are we
Yeah.
credentialed in something? And then also recognizing, especially in this country, state by state, there might be some more lax laws about titles and practices.
Yeah.
So, making sure that you're going with somebody who has your best interest in mind, but also
Hmm.
understands what they're doing. Grace, we talked a little bit about social media just now, so let's get into it. Is there anything currently that's grinding your gears or like hot topics that you, and maybe it's not just directly related to social media, but things that might come up often that you're just like, oh, I wish this was not something that was a trend or something that I didn't have to keep clarifying. What is on the, the hot topic of the week here?
Well, I have a love-hate relationship with social media, and I'm taking a little break at the moment. I'm not even on it very much personally, but I would say I would say that SIBO has become kind of a hot topic. So that stands for small intestine bacterial overgrowth. And while it's something that I definitely address with my clients and is a valid condition, I do feel like it's used as kind of a one and done. Like, oh, you got SIBO, then we'll just get you on antibiotics and that's it. And it's a lot more complicated than that. So I will work with clients who have gone through like several treatment rounds of SIBO, and they're like, I don't understand why it keeps coming back, and this is really frustrating. And so there's a lot that's not known about it by people who are, saying that they're addressing it. And so that can be pretty frustrating to see and to hear about. And I'm frustrated for my clients because, yeah, they're kind of being given the runaround and it's not effective.
That's very helpful. Thank you. Is there anything that you feel we haven't addressed or talked about? Any kind of like words of wisdom, or whether it's things that you wish you knew as you were going through the dietetics profession, or things that you're currently learning in the role that you play now that you'd like to share with our audience?
I feel like a little bit like a broken record, but I would say when I kind of had the same journey of going through different treatment rounds and all of that kind of stuff of trying to figure out what was going on with myself. And I even like treated myself many times, a kind of like an experiment as I was learning more and more about all of this. And the one piece that I was really late to address was the impact that my nervous system was having on from the lifestyle I was leading, the job that I had, just the stress that was put on, I was putting on myself and externally was put on myself. And I kind of left that to the back burner of like, I don't really need to worry about that. Like, whatever, I'm doing the best that I can. And I was probably at the time, but when I finally like kind of had a come to Jesus moment, I guess, and like actually started to pay attention to that and actively address that, even if it was really small in the beginning, that had the biggest impact on my own journey. So I try to come to my clients with compassion and understand that they may be in that place as well, but that it really is that important. So that's why I keep bringing it up.
Well, let's dive a little deeper in that. I've shared a lot of things that I do to kind of manage my overall, both physical and mental health. What are some of the things that, without doubt, if things kind of go wonky within your week, what are the things that you usually return to that feel like you're prioritizing to make sure that
Mhm.
you're managing your health in the best way, both personally and also professionally, so that you can be there for your clients as well?
I am really sensitive to low blood sugar, so if sometimes I find myself like putting off eating and putting off eating and putting off eating because I'm working on something, and I totally regret it every time. And I know that that's something that I really need to just be religious about. And like I know my body the best, and I can feel it coming on. And if I try to override that, that's when I don't feel well either later that night or while I'm sleeping or whatever. So that's a really important piece for me. My hydration is incredibly important as well. And that's not something that I paid as much attention to as I should have when I was younger, and dealing with all of that. And then the other piece would be I go on a walk every day and sometimes twice, and that it's a very important part of my mental health.
How does sleep play a role for you with all the
Uh,
things that you're juggling? Are you managing good quality sleep, Grace?
Yes, and that's another kind of
Yeah.
constant journey. I tend to not be the best sleeper, and so that is something that I am always working on. And the blood sugar management is a big part of that. That can be an issue if your blood sugar is dropping too low overnight. That can cause a lot of sleep disturbances. Making sure my magnesium is at the level that it needs to be is an important piece of that, but also just calming my nervous system down. I kind of have some anxiety and like panic attack related stuff, and I notice that flares up at night. So integrating like that nervous system regulation throughout my day can make a big difference on my sleep.
What would you say to somebody who, we're talking like productivity wise, like in a realistic way, what are some things that they can do to make sure that they are prioritizing the things? Because there's only so much time in a day, in a week.
Mhm.
There's a lot of stuff that goes on. I'm very compassionate to understanding work and travel and kids and responsibilities. And, we sometimes do inadvertently put the onus on the responsibility on the individual to be in charge of all the things. But what would you say would be some good guidance? Like if they say, I'm too busy or I've got these things going on, what are some things that you might be able to talk them through to help them become a little bit more confident in what they can do to manage their own health?
Well, I start with kind of around the meals, so it can be a little bit less like daunting. But I would also kind of encourage them to kind of think about what are things that I'm saying yes to that maybe I can say no to, realistically. And maybe it's only one small thing, like not going to some event or something, or something small, relatively small, that feels like it's not like I'm neglecting my kids or I don't have the time to do that or whatever. Um, to kind of take note of that. And that takes time to just like realize what those things might be. Realize maybe you're taking on too much consistently, and kind of having some self-realization in that process. But really supporting them and kind of talking through that when we can together, can be really helpful.
I appreciate that because, again, I'm trying to have compassion in my life with people, working with patients. We get a lot
Yeah.
of feedback as to what does, what doesn't work. And we're definitely working on a mutually beneficial relationship where you're hopefully, this is how it works with all of your healthcare providers, my friends, but, we're here to provide guidance to you, whether it's through education or counseling. And you are also playing a role that you're going to hopefully implement whatever it is that we're giving you as a treatment plan or an intervention. But then you provide us with feedback, what worked and what didn't
Mhm.
work, the successes and challenges. We help you navigate that and tweak it. But just like Grace was saying, change takes time, or learning the things that are, or
Yeah.
undoing the things that you've been so used to doing, that can take time too. And I'm not talking time like 7 days. I'm talking like years, perhaps,
Yeah.
or right, all the things like chipping away. It's not a 30-day
Yeah.
challenge. It's like, this is your whole next decades of life in that. And I really think it does speak to also considering it, Grace, you might think of this too, like keeping the future you in mind is what I tell people a lot of times
Hmm.
too, right? Like this is how you're treating yourself now. And we can always say, like, if you don't treat yourself well, who you're going to be good to other people for. But it's more about like, what's the investment you're making to the person that
Yeah.
you're going to be in 20 years? And are the things that you're going through right now going to be exacerbated? So whether, it's a small little thing, if you haven't really started moving around in a way that is comfortable and enjoyable to you, what can you do now? Because maybe that'll help you, right, reduce your risk of falls and fractures in the future, or reduce your risk of osteoporosis, or whatever the fun things when we get to be the senior age that we hopefully can live up to. Thank you for all of
Yeah.
this insight. I do have my two final questions for you, Grace. My two-part question is, what is on your plate today? And that is, figuratively speaking, after we disconnect from each other. It's currently in my world a little bit later in the afternoon, a little earlier for you. What is the
Yeah.
thing that you're working on immediately afterwards? And then what is the next meal that you will be eating?
Well, it kind of goes together. My lunchtime is right after this. So I will be having some leftovers from last night. My husband's a chef, so he made a really delicious chicken and rice soup, comforting with lots of veggies. So I will probably be having that and going for my walk. And then I am scheduled to film some of my modules for my program this afternoon. So that's on the agenda today.
Ah, that sounds delightful. And so if especially now during this time of year where soup feels so comforting, I just had myself a little bowl of lentil soup. So I'm on the soup train with you, Grace. Well, it was a pleasure getting to know you and learn more about you. And I'm so grateful that you've shared everything that you have so far with our audience. I hope everybody gets some good takeaways and know that we are in your corner. We're here to help you. Please make sure that you're reaching out and getting the referrals or finding us online if you need support with your health. Thank you again, Grace, for spending time with me today.
Thank you so much. This was a great conversation.